Hello and welcome to a fully vaccinated and socially distanced in the faculty lounge. I'm Paul Hauptman, Dean of the Graduate School of Medicine, and I'm joined today by Deidra Mountain, Associate Professor in the Department of Surgery. Deidra, welcome.
Thank you. Thank you for having me.
Deidra hails from nearby Morristown, Tennessee. She attended Carson-Newman College and then for graduate studies, East Tennessee State University, before coming to the graduate school for postdoctoral studies. And lucky for us, she stayed on as faculty and is now associate professor. She runs the Vascular Research Laboratory, and we're going to get into a discussion about some of her work with uh, nanoparticles in just a little bit. But what we often do, Deidra, in the faculty lounge is to first begin at the beginning, which means asking questions like, why did you get involved in science? And what were your primary motivators to get into vascular biology?
Okay. Well, how I got involved in science. So, growing up and all through high school and undergrad, science and math were always my favorite subjects, obviously, particularly the biological sciences. And so, I entered undergrad as a biology and chemistry double major and with plans to go to medical school and become a practicing physician. And so, I was at a small private liberal arts college and on this very narrow path of pre med. Um, and it wasn't until pretty late in my college career that I was exposed to the potential of careers in scientific research. And very late, actually, in my senior year of college, I began to understand really how a career in scientific research could fit into the field of medicine. And I think I realized that there really was this whole other career path that I'd really never considered as an option. And I love being in the lab and I love doing research. And it became clear to me at that time, and it still is, that my passion and my calling isn't necessarily the practice of medicine, but it always was the science behind it. And so my passion is being in the lab and doing research to figure out ways that we can improve the practice of medicine. And that's what kind of drives me every day. As far as how I got into the field of vascular research, so I ended up in a cardiomyopathy lab in graduate school in my PhD training program. And so I had a background in cardiovascular disease and vascular disease. And really, what I love about vascular research is that vascular pathology it's such a prevalent pathology, and I mean it's peripheral vascular disease and just vascular disease in general is really the number one cause of death and disability in our country. And there's really, especially in this southeastern area of the country, there's really nobody that vascular disease doesn't affect, either directly or through their family members. So the potential to have such a broad, sweeping impact through our work is really what makes the field of vascular research really exciting to us.
I think it's probably underappreciated too that you could argue vascular disease is a systemic disease.
Sure, absolutely.
We always tell cardiology fellows, when someone has coronary artery disease, guess what? They have diffuse vascular disease. It's just a marker of vascular disease. So you're working in an area that's really fascinating now, liposomal nanotechnology and the delivery of drugs and potentially gene therapy. And forgive my ignorance here, but my understanding too is that this technology has some relevance to something very timely, namely the RNA vaccines.
Absolutely.
Can you talk about that a little bit?
Sure, absolutely. So we are working to develop lipid nanoparticle technology for delivery of gene therapeutics, primarily to the vascular wall. It is a very similar technology to what the COVID vaccine actually has been developed surrounding it as a lipid nanoparticle mRNA delivery system. And so it is very timely. It's interesting that we started kind of down this path of research in our lab 6 to 7 years ago, and now all of a sudden it's the hottest topic in science. And so we're real excited about the progress that we've made. Our aim really is to develop a translational therapeutic. We want to develop these lipid nanoparticles in a manner that it's very biocompatible, and so that we can use these nanoparticles to deliver therapeutics directly to the vascular wall at the time of intervention to try to improve long-term outcomes.
And is it delivery on a balloon-coated, is balloon-coated, is it on the stent, or is it just perfusion
C, all of the above, or
Okay,
D, all of the
D,
above.
right.
So we actually have several different projects ongoing in the lab right now. One project involves how we can modify the surface of these nanoparticles to kind of create these spatially controlled nanoparticles. So they would be an injectable therapeutic that would co-localize to the area of vessel disease. And another technology that we're working on is being able to deliver them using balloon-coated or coating balloons, or using drug-coated stents for placement. So,
Yeah, I think one of the real strengths of your lab too is it really defines translational science. It has great relevance to clinical care, and I know that you work closely with the vascular surgeons. Talk a little bit about that.
sure. So I'm the scientific director of the lab, and Dr. Oscar Grandes is the medical director. So we co-direct the lab. It's an MD-PhD partnership that we've kind of forged over a period of several years. I mean, I came here, you mentioned, as a postdoctoral fellow under the mentorship of Dr. Grandes, and then was able to stay and kind of take over more of the day-to-day operations of the lab. But working closely in an MD-PhD co-directorship really keeps our lab focused, making sure that everything that we do is clinically relevant and also has translational potential. And the other attending physicians in the Division of Vascular Surgery are also very involved in the lab. They're all very supportive, very interested in what we're doing. We have the fellows that come and rotate through the lab during their first year of fellowship here. And so it's really a partnership between the physicians and scientists in the lab, and that really keeps us focused.
Tremendous. Now, you were a recipient of some funding through our Women in Science initiative. Tell us a little bit about the challenges that you've overcome being a woman in science.
Sure. Well, the the Women in Science funding initiative really is a part of a culture change that I've really seen happen at this institution over the past several years. We really are becoming an institution that wants to be known nationally for supporting female faculty, and it's fantastic to be involved in an institution that thinks that that's important. The reality is that although about 50%, or the medical school graduation rate is about 50-50 male to female, and the numbers when you look at PhD training programs, they're pretty equivalent as well. But the reality is that only about 25 to 27% of full professorships are held by females all across this country at medical college all across the country. So it's clear, it's evident that females are not progressing in their career at the same rate as their male counterparts. And kind of there are three main reasons for that. One is the difficulty in attaining promotion, the difficulty in obtaining extramural funding, and then just the difficulty in kind of working your way into leadership positions at your institution. Kind of the elephant in the room that nobody likes to talk about, and even women shy away from talking about, is the fact that the time for the most accelerated career trajectory is at the exact same time that women are having children and raising families. And there are a lot of hats to wear, and there are a lot of balls to juggle in the air if you're a woman in this field, and you're trying to, have your career trajectory on the same plane as your male counterparts. And so this Women in Science initiative, really, I see it as there's so many different benefits of this. One, it is if you can provide any scientist a small seed fund to give them a little wiggle room, a little breathing room to maybe either chart a new path of research or continue on a research project that you're trying to develop in your lab or in your practice, then it allows you to obtain some preliminary data, significant preliminary data, maybe even have some time and breathing room to publish a time or two with some collaborators, so that when you formulate this grant application, you actually have evidence that you can prove to the National Institutes of Health or the American Heart Association or the American Cancer Society, whatever the funding agency is, that I can do this work. I have the capability to do the work. I have to know how to do the work. I'm doing the work now currently. I have established collaborators, and I'm at an institution that supports this work and
That's very important.
Resources for me to be successful in this. And so that goes a long way in being able to be competitive for extramural funding. And as I mentioned, that's one of the main reasons that that women struggle in maintaining a career trajectory in academic medicine. So.
Yeah, and we're very confident that the return on investment is going to be very big with this initiative. And I don't just mean financially. I think in multiple ways. And if our viewers or listeners are interested, they can visit us at www.gsm.utmck.edu for more information. An interesting segue perhaps to one of your other passions, which is education. And you've been instrumental in making sure medical students have a lab opportunity, but also now students at the undergraduate level from underrepresented minority groups. We call that program the A CMSP, the Accelerating Access to Careers in Medicine Scholars Program. We thank you very much for all the efforts that you've made in that regard. Why don't you tell us a little bit about it?
Sure. So I guess a couple of years ago, you asked me to take on this role of Director of Undergraduate Research Experience here for GSM. And part of the first charge of that, I guess, was kind of formulating and rolling out this undergraduate program. And really, what we want to do through this program is serve the student populations who are historically underrepresented in the STEM fields and particularly in medicine. And whether that be students who are underrepresented minorities, or students who maybe come from a disadvantaged socioeconomic background, maybe even first generation college students who just don't have those professional mentors in their personal life that can help them navigate the waters and what they need to do to be successful and prepare themselves for matriculation into medical school or into a PhD training program. And what we can offer here through this program, we want to provide those students, we want to identify those students early on. So it's important, we feel like, to identify them early on in their freshman year of undergrad or maybe early in their sophomore year. Identify those students who are particularly promising and have, that we are confident are going to be successful with just a little bit of help and mentoring along the way, and then provide them research opportunities in a medical setting, either in a basic translational research lab or in a clinical research program here at GSM. And then also provide them some professional development opportunities. So letting them participate in some seminar series and provide them with some information about, how do you interview? How do you prepare your CV? How do you write a personal statement? And what are the things that you need to do, and some mentorship in what are the things that you need to do now, early on in your collegiate career, to be competitive later on for admission to medical school or a PhD training program. So.
Well, and we're very excited about this program, and I think you're absolutely right. Mentorship is key. We're both first in our families to go to college. I found out just yesterday, first generation to go to college, and so we have great sympathy too for that cohort. And so a lot of great things happening at the Graduate School of Medicine. And Dr. Mountain, thank you very much for your time today. We're definitely looking forward to future episodes of In the Faculty Lounge. You can view them. They're now a podcast as well. And until then, thank you for watching and or listening.